There are two major blood vessel systems in the body. The arteries are responsible for taking blood away from the heart, and the veins bring blood back to the heart. A blood clot that forms in the veins that migrates to the lungs is called a venous thromboembolism, or VTE. Blood clots can break off and quickly become life-threatening. But to understand why blood clots form in the first place, we need to begin by breaking down this complicated system. Thrombosis is the medical term for blood clot. Formation of a blood clot obstructing blood flow in a major vein is called DVT, or deep vein thrombosis. This is typically in a leg vein. An embolism is a blood clot that breaks off from a DVT and travels in the bloodstream to another part of the body, typically the lung. It is then called a pulmonary embolism, or PE.
So depending on where the clot is, it can fill the whole width of the vein, and it can be just a short distance, or it can sometimes be the complete length of the vein in that segment of the leg, so they can vary in size tremendously.
At Charleston Orthopedic Associates in South Carolina, Dr. Richard Friedman says there are a number of factors that contribute to blood clot formation.
You can develop what's called a hypercoagulable state, where the blood wants to coagulate or form a mass or a clot. You often have some type of tissue trauma that releases various factors that also promote the clotting, and then also there's some change in flow. Generally we say there'd be some stasis, a lack of flow, and when there's not the proper flow, it again predisposes to the formation of a blood clot.
At the University of North Carolina, Dr. Stefan Mahl is an associate professor.
There's one individual in the U.S. who develops a DVT or PE every minute of the year. And every 5 minutes an individual dies from PE. About a third of these deaths are sudden deaths, where there's no warning, but risk factors may have been present. 2/3 of the clots have some symptoms beforehand, but many of these symptoms are not recognized and the diagnosis is delayed. And then the problem occurs that the patient develops a massive PE and dies, even though he or she has had symptoms for the last several days that could have been recognized.